Okay, so today's video is actually a on-demand video. So as you know that whenever I make a short or whenever I make a small video or a long video, in the end I always say that do read more about this topic, because on those short period of time I can give you a little bit info to sensitize you about that topic, and there are some facts which can be learned only by reading in detail. So many of you have asked on the channel that what are the books we need to refer, what are the books I can suggest which needs to be read in order to learn more about that particular subject in the ICUs. So today I am going to show you my experience, and which I suggest to my colleagues, which I suggest to my students, which I suggest to other members from where they need to read. So there are 4+1 book, and every book has its own style and purpose and timing when to be read. So we'll start with the first one. So this is the ICU book by Paul Marino. The ICU book by Paul Marino. So this book is for anyone who is just entered the ICU. Means anyone who is fresh enough in the intensive care unit, or the first days in the ICU, or starting to learn about intensive care medicine. So this book is very basic, but still it covers a lot of things. It tells you about what are the hemodynamic monitoring concept, ventilation concept, acidosis, blood gas concepts, a little bit about electrolytes, other conditions, arrhythmias, cardiac ischemia, but plethysmograph, all things, procedures, all things are there in this book. But this is a very simple language, very fluent language. It will sensitize you about what we are doing in intensive care unit. And the good part about this book is you can finish it very fast. A new candidate can finish it in 2-3 months, one reading. And if you really sit down on it, within 1 month you can finish it, and it will give you an idea about what to read next. So this is the first book which I read when I started. I recommend to each and every candidate who is just joined the ICU to go through this book at least once. So it gives you a beautiful idea. It's a very simple book, very fluent, but still very, very important. Now the second book which I will suggest is this O's intensive care manual. This is actually will serve you as a textbook for intensive care manual. It will serve you as a textbook which needs to be used in intensive care. This is a very good book. It covers almost 99% of all the topics, not too short, not too lengthy, but I prefer to say that this is actually a textbook for anybody who wants to learn more about intensive care medicine. It is a textbook which needs to learn from starting to end. And once you have read that, I can assure you that almost many topics in intensive care you will get a lot of clarity. The language is a little bit not so simple as compared to the Paul Marino, but both books serve the different purpose. So once you have read the ICU book, you should consider this as a textbook and start reading. Once you saw the patient, read that particular condition about that particular patient from this book, and you will get a lot of insights. So it's a very, 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 very nice book which should serve you as a textbook for intensive care medicine. Now once you have read this O's textbook of intensive care, the O's intensive care manual, this is the book. This is the third book. This is Washington Manual of Critical Care. This is one book which I call this as a lab coat book. This should remain with you in the ICU all the time. But this should not be your starting book. Once you have read the O's intensive care manual, once you have read the topic from that, this book will help you to remember that topic in a very fluent manner. The good thing about this book is it contains lots and lots of algorithms. So suppose you have read a topic about acute MI from O's intensive care manual, and then when you read from this, you will understand a lot better. There are algorithms, tables which you are able to recall when you are seeing the patient, or when there is your exam, and you can recall point wise point, this needs to be done, this needs to be done, this needs to be done. But if you start with this book in the starting that okay, I will start this book and I will remember the algorithms, I will remember the table, then it will not serve the purpose. You will not get benefit out of it, because it will not clarify your things in detail, which the O's intensive care manual does. Those intensive care manual which help you to develop the concepts about those condition, and this book will allow you to solidify those concepts and will help you to remember, which you can apply in day-to-day practice in your exams, vivas. So this is a lab coat book which I think on every ICU desk or chamber at least one book should be there, from which the residents can read and discuss and go through it once they see the patients. So this is the third one. Now now the fourth one is a reference book. So here are three categories. So these are reference book in which once you have gone through, you have solidified concept, you need to read a little more in more detail about the trials or what this school of thought says, what this school of thought says, and what are the coming researches, and so what were the previous researches, sort of things in detail. So there are 2-3 books in this category. One is called Dellinger, Intensive Care Medicine. One is from the Shoemaker, but I prefer this Irwin Rippey's Intensive Care Medicine book. So this is you can see it's a very solid book. You can have weightlifting also from it, but it's a very good book, very fluent language in it, but it's a long book, and it's a reference book which I use when I get stuck in certain topic. I need to clarify certain more things, or I need to make a lecture on which I need more and more details about something, then I refer this book. Not daily, but most of the time when you have a lot of practice and when you have solidify your concepts in intensive care from Oz and Washington, then you can go through this book. Anybody interested to read more in detail about a particular topic, you should definitely prefer this Intensive Care Medicine by Irwin Rippey. Okay, so now after these 4 ICU books, I have one bonus book which is for those who are working in emergency as well as ICU. So the working in emergency is a little bit different because they need to stabilize the patient, identify a patient from the symptoms, and then shift to intensive care. Intensive care is a lot different branch. So this is one book which covers a little bit about both, but primarily on the emergency medicine. This is Current Diagnosis and Treatment in Emergency Medicine. This is one of the favorite books, I would say. I don't know, very underrated, but I have read a lot from this book. I have got benefited from this book a lot. What this book does, it has divided the chapters in symptom-based approach, chest pain, hematemesis, dyspnea. So first approach is like this. Then it has also given the topics regarding trauma, non-traumatic condition based also. Okay, MIs and other issues like pulmonary embolism or hematemesis or strokes. So this is very good book. The good part is it has covered from the symptomatic approach, gives you what are the clinical signs, what are the lab parameters which you will find, and how to approach. Though the things are a little bit short, but I can assure you that once you start reading this book, this is a very beautiful book. This is a bonus out of the box books which I love a lot, and it is very useful to me in the ICU also. So these were the books which I recommend or which I have read and I used to suggest to my colleagues, members and students. And so if you have any experience with all this textbook, do share in the comments. If you have any thoughts which you want to know further, you can post in the comments. So that's all for today. Thank you.